everything is all wrapped around one.
Okay, thank you.
Good question. Okay, let's talk a little bit about those facet joints. You remember those facet joints were the joints that, as the vertebrae pile on top of each other. That's the posterior bony connection. So anteriorly, we don't really have a direct bony connection. We've got a disc in between the bones. In the back, this is your posterior bony connection or joint. It is a synovial joint. It does have a synovial membrane and an articular capsular ligament. Also in the thoracic area, so besides facet joints, in the thoracic area, you're going to have what we call costal facets. In other words, connections for your ribs. Okay. So the motions allowed at each spinal level are determined by the direction of the facet joints. Okay, so in the cervical area, we can get all motion. So we can, in the thoracic area is mostly in the frontal plane. So mostly a little bit of rotation, a little bit of lateral flexion, but you're not going to have as much movement in the thorax area because of the rib attachments. And then the lumbar and the facet joints are found in the sagittal plane. Mostly what we do lumbar is flexion and extension. Yes, we can get some lateral flexion, and yes, we can get some rotation. The majority of what needs to happen is flexion and extension. Okay, a lot of the rotation that appears low spine is really a conglomerate movement of the whole spine. Same with lateral flexion. Okay. So let's just kind of look at special features as we go through the spine. So cervical spine is your neck. So we know that it should be freely movable. Its purpose is to support the head, allow freedom of motion of the head on the neck, allows for the nervous tissue to enter the vertebral canal. So you remember we're going to have openings as well, vertebral foramen, okay, all the way along so that those anterior and posterior roots can come in and out. And it allows for the entrance and exit of major blood vessels in the skull. So again, when we study other things, we know that we've got these vertebral arteries, and there's little, like you need to probably come up and look, but there's a little place here for that vertebral artery to run. So it runs actually up and down the neck within the confines of those little foramen.